during this event. So if you need to move around, get out of your seat, take a sip of water, coffee, whatever your body may need, please feel free to do so. You won't get in trouble or anything. And lastly, we will be sharing slides with you all. So the best way to enjoy this event is to put it on speaker mode instead of the grid mode. That way you get the full effect of our visuals and the awesome backgrounds that our communications team has done. So props to the communication team if y'all see those amazing backgrounds. So as people are joining in, just a quick reminder, please put your name, pronoun, and organization in the chat box. And also just a reminder for media, we will be answering questions at the end of the event. So please enter those into the chat box as well. And so it is 10:05. Welcome everyone. It's so great to be here with all of you today. My name is Maribel Cruz. I'm with the Long Beach Immigrant Rights Coalition. And today we're here to make a call for our legislators, for our governor to invest in our immigrant communities. We want to go ahead and make sure that immigrant communities, no matter their immigration status, have access to healthcare. We've all seen the detrimental effects of not having healthcare, especially for our seniors and our most vulnerable populations. As an undocumented person myself, and as someone that lives with folks that are aging and are undocumented, that is definitely a concern that I have for my family. And I'm pretty sure millions, if thousands of people already have that concern as well. So we've had such great success with the Health for All campaign. Throughout the years, we've had Health for All kids, Health for All young adults. However, there's so much more that we can do in order to make sure that every Californian has access to health care. COVID-19 has shown us the urgent need that Medi-Cal is needed. And we want to go ahead and make sure that no immigrant family is left behind. We already know that immigrant families are being left behind for direct financial aid services, unemployment benefits, but healthcare is something that we can actually make a reality to make that one less thing for families to worry about. And so together, all of us, we have the power to make this a reality. And so I'm so excited to be with all you and actually speak to community members and legislators that are in the fight for this amazing, amazing piece of legislation that we are going to be unveiling today, which is the Health for All. So to start us off, I just want to go ahead and once again remind, if you're here a little bit late, put your name, pronoun, organization in the chat box. Media, we will be taking questions at the end, but put those questions in the chat box. We are taking note of those. And so to start us off, I would like to introduce Orville Thomas from the California Immigrant Policy Center. Orville, welcome. Please let us know what you want to tell us about the event.
Thanks, Maribel. Californians have lived with COVID-19 for over a year now, and while every person has been affected, the deaths and devastation have disproportionately hit immigrant communities and other communities of color hardest. The virus might be the cause of death, but the real killer for us has been a historic lack of investments in health equity and a lack of expansion in health care. That's why the work of this coalition is so important and necessary. Since 2014, the Health for All partners have fought and won Medi-Cal expansions to immigrants with Health for All kids and Health for All young adults. And while we move closer to expanding coverage to seniors, our guiding light and mission remains ensuring all Californians, regardless of immigration status, have health care coverage. So it is my great honor to introduce our next speaker, one of our Health for All champions in the legislature and author of Assembly Bill 4, which would expand Medi-Cal to all that are income eligible by 2026 with no barriers to care because of immigration status. Please welcome the Assembly member from Fresno, Dr. Joaquin Arambula.
Thank you, Orville, for that introduction. I couldn't be more pleased to be here today with the coalition standing up for health for all. Whether it is CIPC or Health Access, MyCop, Civic, all of the groups who have stood up for our expansion for kids and young adults, it is important for us to recognize during this pandemic the role that healthcare plays in helping to prevent diseases that occur in our immigrant communities. I do want to, if I can, speak for a second just about what motivated me to run for office and why this has been the first bill I've introduced in each of the last few legislative cycles. And it is because of the lessons I learned in the emergency department of everyone who came in through my doors required services regardless of their immigration status. That lesson that healthcare is a human right that I learned in the emergency department is something I hope that our state of California will also take lessons from. If we are serious about ensuring that we have equitable access for preventative care, we need to make sure that our immigrant brothers and sisters have access to the same types of services that we can by extending Medi-Cal to everyone in the state of California who are income eligible. Now, I am quite proud that this coalition has been able to get some successes over the last several years, including SB 75, Health for All Kids, Young Adults in 2019, and hopefully we can achieve and expand on Health for All Elders this year that Senator Durazo will talk about. But I do want to make sure that we never lose sight of that North Star, that guiding light, that healthcare needs to be for everyone in the state of California. And for that, the reason why we are pushing so hard on Health for All this year is to ask the governor when are we able to achieve Health for All, and how can we start making meaningful steps towards that goal? My hope is we can have a down payment this year and continue to strive and hope we can achieve Health for All within this governorship. Now, for us to be effective, though, we have to hear the stories of our community members. And it's why I'm so pleased that the next speaker who is here today is able to talk about their struggles, their issues with accessing healthcare through normal mediums when you are undocumented. So hopefully you will listen with me to their stories and continue our advocacy towards Health for All. I am honored and privileged to introduce this legislation, to work with this coalition, and to fight for healthcare as a human right. Thank you for allowing me to be here today.
Thank you so much for those words, Senator Arambula. This is definitely a piece of legislation that will affect immigrant communities, and it will impact them so positively. As I mentioned, I myself, although I do have DACA, I grew up without health insurance because I was undocumented, and it took for me to get a job once I had DACA to actually be insured with healthcare. And my concern right now is my parents. They are aging, and so they are undocumented. What are they supposed to do? Healthcare is so expensive. Even in emergency room, many immigrants see the emergency room as preventative care, and so we have to fix that. As advocates for immigrants, and as immigrants ourselves that live this reality, this is something that we think about on a daily basis, and has even become more of a focal point now that we're living in the middle of a worldwide pandemic. So this is definitely something that hits my heart, and thank you to all the champions that are fighting for this along the communities that really, really are advocating for themselves as well. So the next person that I would like to introduce is someone that's been working for immigrant access through for many years. So it is my privilege to introduce Ronald for Health Access, Ronald Coleman. Ronald, welcome. Please let us know what you think.
Thank you very much, Maribel. Certainly all the stories that we hear about people without access to healthcare tell us why it's so important for us to achieve Health for All. We believe that California's health system and Californians in general are healthier and stronger when every Californian has the opportunity to have affordable, comprehensive healthcare. Without access to comprehensive healthcare coverage, some community members with chronic conditions self-impose limits on doctor visits, ration prescription drugs, or even skip needed tests or screenings. Parents, caretakers, and other undocumented workers are often forced between paying for healthcare services or other vital needs for basic living. The pandemic has put a spotlight on the alarming health disparities impacting communities of color. By California continuing to lock out the undocumented, mostly people of color, from access to Medi-Cal, the state continues this racial injustice. We also know that this pandemic targets seniors, and for that reason, we must prioritize access to Medi-Cal for undocumented elders in this budget cycle. A little over a year ago, Senator Durazo worked with the Health for All Coalition to secure a commitment from Governor Newsom to expand Medi-Cal to undocumented seniors. However, the governor has yet to make an investment despite where he says his heart and his mind are. We've appreciated Senator Durazo's steadfast leadership on this issue and her tireless fight to ensure that The most vulnerable in this population who are at high risk are able to gain access to healthcare. This year, she has introduced SB 56 to expand Medi-Cal to undocumented elders, and we are grateful. So without further ado, it is my pleasure to introduce the Senator from LA, District 24, Senator Maria Elena Durazo.
Thank you so much. And thank you to the coalition for your incredible hard work without from the bottom up. That's what I've learned as an organizer my whole life. It is on the ground. That's what matters. That's where our strength is. Thank you, Orville. Thank you, Ronald, for your leadership, and especially my colleague in the legislature, Assemblymember Arambula. It's been said over and over, and every time you read an article about these disparities in our society and this pandemic, I think it's trying to give us another message. Come on, you know, we have to close those disparities. Nobody should be suffering more because of your immigration status. And this is especially true because there are 1.5 million low-income, undocumented Californians, and the ones that are most impacted, even amongst them, are our seniors. So in the midst of this, our undocumented, are precluded from wage replacement programs like unemployment, in spite of the contributions that are made on their behalf. They face barriers to safety net programs. And frankly, in the beginning of this pandemic, we didn't even actually account for them when it came to testing and treatment. We had to keep making that an issue. We know undocumented Californians contribute. They put into this, into the funding of the state, $3.2 billion in taxes are paid to fund services like Medi-Cal, and yet they are still denied access to primary care. They are the working poor. They contribute. The working poor. So we're focused on my bill to cover 35,000 California residents older than 65 to have access to Medi-Cal. They have not had health care in their lives. They do not have access even for regular routine checkups. They can't get preventative screenings for cancer or heart condition. They're forced to rely on emergency rooms. That doesn't make sense. They're more costly.
I don't know why.
This pandemic has exacerbated the inequities in our public health care system. So Latino residents 3 times as likely as Black residents, and Black residents are twice as likely to be hospitalized. We've seen those numbers over and over. In my home, in my district in East Los Angeles, 1 in every 10 people tested positive, making it the highest recorded tally of any region in LA County. Last year, we had a commitment from the governor to get this done. Now the question becomes, if we are not going to do this now with our windfall, when are we going to do it? Yes, it's going to cost money. Yes, there are difficult decisions to make, but doing nothing costs more and costs more lives. Undocumented seniors should not wait another 3 years or even 2 or even 1 for this Medi-Cal expansion. I just want to end by saying 25 years ago, we fought against Prop 187. Because it was trying to separate out undocumented children from education. So we're still trying to get undocumented families included in healthcare. There's something wrong with that picture. So thank you all for supporting SB 56 as a step towards a truly healthy state. Thank you all very much.
Thank you, Senator Durazo, for those words. I think we all agree with you that something needs to be done ASAP, as soon as possible. And I want to thank both Assemblymember Arambula and Senator Durazo for being champions for immigrant health. You know, we see a lot of positive things that can come out of this. So excited about this. We know we can do it. This is the year. So the essence of Health for All is community that is directly impacted, community that is suffering the effects of not having healthcare. So we want to go ahead and uplift the stories of those folks, right? And so right now we're going to have a speaker, 76-year-old gentleman that will be one of the beneficiaries of a Health for All seniors, Health for All coverage. So I want to go ahead and introduce Don Pedro Montes Vargas, who will be sharing his story. Don Pedro, ¿está ahí? ¿Me escucha? Bienvenido. And I think we'll have some introduction. So Don Pedro will be speaking in Spanish and he will have interpretation in English. Don Pedro, bienvenido.
Va a hablar en español y va a tener quien lo traduzca a inglés. Bienvenido, para iniciar.
Sí, ya digo.
Ya.
Buenos días. Soy Pedro Montes Vargas. Doy mi testimonio. Soy indocumentado mexicano y aquí he trabajado mucho tiempo en Estados Unidos.
¿Y se me deja, don Pedro, para traducir por usted? And so I'm gonna translate for Don Pedro, and so he's just introducing himself. His name is Don Pedro, and he's been working in California for a really long time.
Continúa.
Sí, he trabajado mucho aquí en Estados Unidos y hasta estas fechas, y nada más que ya no, porque me enfermé de una mano y ya no pude trabajar. Y ya he estado, pues sí, sé que aquí ha estado, ahora que no puedo trabajar, voy a reciclar para ganar algo, porque
So he has been working most recently collecting recycling and making his money that way.
y entonces hice una cita a la clínica para ver si calificaba para bajos ingresos, y porque andaba con dolencia de cabeza.
And so he made an appointment at the clinic because he had some pain in his arm and he wanted to get that checked out.
Y fui, pero me dijeron que no calificaba y pues no, sé que sí me dieron medicina y la pagué, pero luego me siguen llegando biles todavía que pagar.
And so he went because he thought he would qualify for low income services, but unfortunately they gave him a big bill and they charged him a lot of money for his medication.
Y ya que me checaron en la clínica, me sacaron alta presión y diabetes y colesterol.
And so in the clinic, they found that I had high blood pressure, high cholesterol, and diabetes as well.
Sí, y pues ahí ando pues dándole lucha, pues de un modo y de otro a juntar centavitos para pagar lo que me llega de cobro. Y aquí está, también tengo mi señora, pero como ella ya también tiene su edad, ya no trabaja también.
And so now I work a lot just to get the money so I can make those payments for my medication and my medical services. And so I also have my wife who works, but she's older too, and she can't support me as much as I would like. So yeah.
Gracias, Don Pedro, por su testimonio. Thank you, Don Pedro, for your testimony. We really appreciate it. ¿Algo más que quiera agregar? Anything else you would like to add? I think he might have frozen, so we're going to go ahead and thank Don Pedro for his testimony. We're live, and this is why we're here. We're here to hear community stories. We're here to acknowledge the struggles but also the ways that we can make and improve and bring back dignity to immigrant lives, Californian lives. So this is why it's such a great event to be here today. And I want to go ahead and do a quick reminder to the media. If you have any questions for any of the speakers today, please put your questions in the chat box. At the end of the event, we will go ahead and answer some of those questions if time permits, but just drop them in there, please. And so Don Pedro is a great example of immigrants that have lived in this country for decades, even more so than in their native country. And so the least that we can do is provide them a dignified healthcare. And so I want to go ahead and also highlight more community stories. The next speaker wants to share a little bit about her family and her story. And I want to go ahead and welcome Dulce Garcia. Dulce, welcome.
Thank you. My name is Dulce Garcia, and I'm a DACA recipient, and my parents are still undocumented despite being in this country for many decades. My dad is 61 years old, and somehow he figured out how to file taxes in the 80s and still has been here. And even though I'm an immigration attorney, I can't fix his papers. There's no path to citizenship for my father. And it's frustrating, especially as an immigration lawyer, to not fix our own family's legal situation. But my dad's a welder. He has been for over 35 years. I remember when I was growing up, in one of those times he was welding, and of course that means getting paid under the table, less than minimum wage. When he fell at one point and broke his arm, he was terrified, not only of immigration, but he was terrified of the bill. He was scared that someone was going to turn him over if he incurred thousands of dollars. So he just toughened up, went home, even though his arm was shattered. And he waited for about a week until it got really, really bad and incredibly painful for him. When he finally went to a doctor, the doctor told him, you have to go to the emergency right now, or they're going to have to amputate you any longer. So he went to the ER, and sure enough, he incurred thousands of dollars. And the lawyer that tried to help him with his workers' comp realized that there was just no money for the employer to pay for him. So he called it a lesson learned, and he didn't go to the doctor from there on. And he always would say, well, it's like going to the mechanic. What's the point of lifting the hood and knowing everything that is wrong with you if you're not going to follow through? And so he doesn't get regular checkups. He doesn't go to the doctor to see what is wrong with him. So I can't tell you if he's got diabetes or high blood pressure or anything, because he refuses to go to a doctor and get in more debt. One of the more recent examples, and of course this means his teeth, like they've fallen out, is just everything you can think of that we do on a daily basis impacts him with the lack of healthcare. And it wasn't until recently that I found myself more financially stable that I was able to take him to see an eye doctor finally. And it turns out that, yeah, not only did he need bifocals and glasses, but he was showing signs of glaucoma, having been a welder for many decades. And monitoring him for glaucoma means taking medicines, doing eye drops, having special scans done. All of this added to hundreds of dollars that he didn't have. Fast forward a couple of years from that, we go back to the eye doctor. The doctor asks him, well, did you continue with the drops? And he said, no, because I didn't have the money to refill them. And that's what it's like to not have access to healthcare. It's having this fear of you're going to get in so much debt and you're not going to know how to get out of it, because even earning one single dollar as an undocumented person and as an undocumented senior, it's incredibly difficult. So our parents are having to depend on us as folks that are now able to provide for them. And so now that I'm in a position where I can finally take my dad to get his glasses and get checked in for glaucoma, you know, I want him to not have this feeling of burdening our family and making sure that he's taking care of himself, because even to get tested for COVID-19, he's refusing, no matter who around is getting positive tests, you know, because he again, he's in his mind of, well, if I can't pay for it, then what's the point? And I think that's the importance of Health for All, is giving people a peace of mind that you can go to the doctor and prevent things from getting worse. Instead of hearing the words, if you hadn't come in right in time, we would have amputated. And so I think that's the importance of all of us pushing for Health for All, and it should include our seniors, and it should include really everyone that is in need of this. Thank you.
Thank you, Dulce, for sharing your story. I, hearing you and hearing the story of Don Pedro really bring to light the reason that we're advocating for Health for All. No person, no immigrant should have to hear those words of, if you would have just come early, your life could have, been dramatically different, or your life could have been saved. That's like every family's worst nightmare. And so we want to go ahead and change that. That's why we're here. We want to make Health for All a reality for all Californians, and we have the power to do so. If we need to do this, especially now during a global pandemic. We have the power. We have community behind us. We have their stories. We can come together and work together to make this a reality. And so this is why your presence here is essential, and it's crucial, because without any of you, none of this can happen. And so I just want to go ahead and just remind everyone, preventative care can save lives and brings back dignity to the lives of all immigrants. All immigrants deserve healthcare. And, we want to empower our communities to also fight for healthcare. We want to hear their stories, uplift their stories, and highlight them, because they are living the everyday reality of living in this country without healthcare. And so thank you all for being here during this press conference. As I mentioned before, please, if you are media, leave your questions in the chat box. We will go ahead and now transition to Rachel, who will be answering some of the questions that y'all have entered in the chat box. Thank you. Rachel?
Thank you, Maribel. Again, appreciate everybody for sharing their very powerful stories. We do have, again, my name is Rachel Lynn Gish. I'm with Health Access California. If you are a member of the media, please share your questions in the chat box, and I will read them and get them answered. The first question that we have comes from Susanna Gonzalez, and she asked, what will the state need to do to expand Medi-Cal to all in the budget, and how many immigrants may benefit from that? I'm thinking maybe one of our legislative leaders, maybe Assemblymember Arambula, could start if you want to answer part of that.
Thank you for that, and really wanted to, if I could, just highlight and elevate Don Pedro and Dulce's comments. For many of us who are advocating for this, it's a great reminder of community stories and is reminiscent of the patients who I saw come into my emergency department. Now, to answer your question specifically, I do think we need to break it into the parts in which we are trying to accomplish this year. And so the focus is on Health for All seniors this year, and the estimate last year is that's 30,000 seniors who are over the age of 65. It is a budget discussion for us to engage on, and I look forward to partnering and championing with many of the organizations here so that we can elevate the concerns of people just like Dulce and Don Pedro. And hopefully our budget can reflect our values. It wasn't lost on me that Dulce's father has been paying taxes since the 80s, and yet he still has fear, and he's still concerned about debt, and he's still delaying care and getting sicker because of that. I believe us as a state have a responsibility to stand up for our immigrant brothers and sisters who have led to the windfall that we have now as a state, and look forward to those budget discussions.
Yes, thank you, Assemblymember Arambula, and all of you. This has been a very difficult to get through with the governor's commitment. We have to be constant reminders to him that the current system does not work. It does not work for California to exclude 1.5 million undocumented. It just doesn't work. It doesn't work for any Californian to have the elderly as an example of an undocumented population, the elderly not have access That's just not what a progressive state should be proud of denying our seniors access to preventative care. It doesn't make sense. I understand there's a cost, a financial cost to it, but they contribute, they have contributed, and this is when they need it, and this is when they should get it. So we have to keep making that case. We can't run away from it. We understood because last year the governor had included it in January. He changed it when it came to the unexpected crisis of the pandemic. But we know now that we can get out of it. We see light at the end of the tunnel. This isn't going to go on for years and years and years. And people are dying. The cost is money on the one hand, but they're dying. $100 million is not going to break the budget of California. $100 million to save people's lives is really urgent. And we just have to keep pressing that issue with the governor.
Thank you, Assemblymember and Senator. The next question comes from Kim with the Sacramento Bee. What can the state do better to stem the spread of COVID-19 in Latino communities who have faced the brunt of COVID infections and deaths nearly a year into the pandemic?
Well, we could get towards health for all. We have to actually look at the systems of healthcare that we have and notice that the disparities track along with our ability to access healthcare. Our immigrant brothers and sisters, many of our Latinos, are struggling during this pandemic because of that lack of access to healthcare. And really do believe that this pandemic has highlighted the need for us to focus that the health of each of us is dependent on the health of all of us. It's not as if during this pandemic we're excluding our immigrants from testing or from vaccinations. We see the importance as Californians to ensuring that we have equitable access to services during this pandemic, that I believe it's important for us to also focus on those similar accesses post the pandemic, and would just elevate the need for us to pass health for all, for us to effectively change the systems that are leading us towards these disparities.
Can I just?
Yeah, please add.
Quick, I know there are probably others who can contribute as well, but I do think that we have to recognize that this pandemic has not hit equally across the state, all of our communities and all of our neighborhoods. There is a special crisis going on in our Latino, Black, and poor communities. We have to give them the focus that they need, that those communities need to get through this pandemic, in addition to everything that Assemblymember Arambula said. But we have to give special focus. We can line up 1,000 guards outside the Capitol to protect it. What about putting 1,000 guards in our communities as civilians to help bring attention, to help bring services, to help bring vaccinations to those communities? That's equity. We don't need equality. We need equity. And that's the attention that we have been trying to bring to, we've been trying to bring this to the attention of the administration.
Thank you. The next question is from Rachel Bluth at California Healthline. It's been politically difficult to pass these bills in the past. What is different this year? I might have Ron from Health Access take the first stab at answering this question.
You know, certainly folks had thought that this was going to be a politically difficult, but certainly the caucuses have been in the right place in both houses for many years, and these issues have advanced through the legislature successfully. You know, certainly I think the issue related to how we may be able to pay for this has been something that has been caught up in the politics, just given the many other choices legislators have to make around prioritizing different resources in many ways for sometimes being the same community members. And so, you know, certainly this year, we know that we're still in the middle of a pandemic. We are facing this pandemic that is particularly targeting seniors. We know that seniors are at high risk of very serious complications and death from COVID-19. It's important to make sure that we can put seniors, undocumented seniors, on the right path this year. And so we do believe that legislators and the governor will recognize, continue to recognize the importance of this issue, and we will need to continue to work with the governor to try to ensure that this is seen as part of something we need to do for COVID recovery. Certainly, as undocumented seniors are getting sick, families are spending their last dime trying to make sure that their family members are safe and that they can recover from the various illnesses. We appreciate that the state has set up a program that has allowed for individuals, regardless of status, to get treatment for COVID-19. But certainly, a person that may have respiratory symptoms doesn't know if they have a bad cold, bronchitis, pneumonia, or some other type of infection that could get worse and eventually cause death. And so we need to make sure that we have comprehensive health care for undocumented population, especially our seniors in this environment. And we absolutely think that you know, we'll be able to be in a place to get an investment to handle this issue to help us recover out of the pandemic and allow all Californians to thrive.
Yeah, hi, and Orville Thomas from CIPC, and I could just build off of some stuff that Ron said. I think, you know, one of the things that's different this year is just look around. We kind of have known that the gaps that are in the safety net were there, but COVID's made it all the more visible. And so when we're thinking about why this year would be different, there's nowhere to hide the excuses for investing in our communities that are hardest hit. And we have great champions in Senator Durazo, Dr. Arambula, and our other champions in the legislature that have been, you know, yelling from the rooftops that this is the time. Even last year, we had this conversation. We went all the way through the budget. We were very close, and then COVID came, and we had uncertainty. Now we know that the deficits weren't as great as they were projected. We probably could have gotten seniors covered last year going into this year, and think about the difference that would have made. So California during the Trump years was very reactionary on some of their policies, and now we have an administration that we've all hoped for and we worked hard to get in place, and we have to be, you know, leading the way to show the federal government why covering everybody is a great opportunity to fuel the recovery coming out of COVID. We can't get back to what we were, and we don't want to get back to what is considered normal, but to get back to California's way of everyone working and being healthier, we need to cover all Californians and allow for Californians to take part in equitable recovery. We can't just keep talking about equity, especially the governor's administration. We need to be actually investing in the equity at the health level and at the economic justice level.
Do the Assembly member or the senator want anything to add about why this year might be different for Health for All?
I think they covered it perfectly.
I'm sorry, can I just add one thing in terms of the attention that the pandemic has raised? There are industries where undocumented continue to work in and for which we ought to be on our knees and grateful. Agriculture. Without those workers, where would we be with the food that we need to put on the tables? The rest of us who live comfortably, who don't have the same fears, we owe it to those agricultural workers. And yet, what do we find? They are the deadliest jobs, the deadliest jobs. People in those industries saw the chances of dying at 40%, double to 40%. This has got to make a difference with this administration to say that should not be it. Part of the reason is because our healthcare system doesn't work for all.
Thank you, Senator. That was our last press question. If there's any final questions, please put them in the chat. But again, this was recorded and other reporters may reach out later and ask questions. So I'm going to throw it back to Maribel, who will conclude the program.
Thank you, everyone, for being here once again. We all realize the importance of immigrant health, and we are all here together to make this a reality. We want to go ahead and, make this a reality for Don Pedro, for Dulce's dad, for my parents who are aging, and for all immigrants, because all immigrants are deserving of healthcare. All immigrants are deserving of dignity. And what a better way to start 2021 than to continue this fight for health for all. So thank you, everyone, for being here. It's a pleasure to be in La Lucha, as I say, for this fight for equity, healthcare, and human rights. So thank you all, everyone, and have an amazing day today.
Thank you, Maribel, so much. And so now, if you are a coalition member, if you are a Health for All partner, community member, please stay on. We are going to get into our coalition convening. If you are a member of the media, please exit now. Thank you so much to our legislative champions for joining today. We really appreciate your presence and your continued leadership in this fight. So again, if you are a coalition member, a community member, a Health for All